Hi, I'm Jamie Kondis, and today I'm going to talk to you about infant colic. So what is colic? We're not really sure why some babies get colic. The definition you can remember with the number 3. It's babies who are less than 3 months old who have prolonged periods of crying for more than 3 hours a day, greater than 3 times a week. One thing to remember about colic if you're a parent is it is what we call a diagnosis of exclusion, meaning we need to rule out more serious things first before we can give your baby the diagnosis of colic. So what can you do for a baby that has colic? Well, it can be very tough. One thing is to make sure that you yourself as a parent are not getting too stressed out. So take breaks when you need them. Have somebody else there if you can. But if you need to, if your baby is crying so hard, sometimes you can just put the baby down and walk away and go take care of yourself, because that prolonged crying can be really hard on a parent. Sometimes you can try what we call the 4 S's. The first S stands for suck. Giving the baby something to suck on, like a pacifier, can sometimes be soothing for them. The second S stands for swaddle. Putting the baby in a swaddle and putting it around their arms can sometimes help them feel more secure and stop crying. The third S stands for sway. Just gently swaying the baby back and forth with your arms, or putting them in a baby swing set and letting them sway back and forth that way. And the fourth S stands for shh. Making a soothing sort of noise, like a shh, to the baby can sometimes help them stop crying. So that's a technique you can use if your baby has colic. Colic can be very challenging, but the good news is that babies do outgrow it after a few weeks and go on to be perfectly normal. So if you get a diagnosis of colic, just try to ride it out, try those 4 S's, but always bring your baby in if you're ever worried about prolonged crying.